Hello, Shade lovers. Welcome to another episode on Medication Monday. We are still on the statins or cholesterol lowering medications in kidney failure management. So just to add on, so with regards to the statins, I've already spoken about the fact that we've got long acting and the short acting. So on your long acting, it's got to do with your atorvastatin and rosuvastatin, and the short acting has got to do your simvastatin, fluvastatin and pravastatin and others. So today we'll be focusing on other thing that we need to get to know of, which is called the water soluble statins and the fat soluble statins. We've got two. So fat I might be exchanging the words of fat and lipid. It means the same. Let's to help with people that I don't confuse people, sorry. So with regards to the water soluble and the fat soluble, we'll be focusing more on the fat soluble. We know that these statins, they work primarily in the liver to inhibit the enzyme that have HMG-CoA reductase to lower cholesterol. But with regards to the fat soluble, lipid soluble statins, example of the fat soluble and water soluble. So I'm going to start with the water soluble. With the water soluble, we've got just two. We've got rosuvastatin and pravastatin. Those are the water soluble statins, and the rest are fat soluble statins. So you've got your atorvastatin, you've got your simvastatin, you've got your fluvastatin. Now, with the fat soluble ones, they are not just limited to the liver, but they've got what we call extrahepatic effect. Basically what it means is that they are able to get to other sides, that such as the skeletal muscles or the brain. This is because they are fat soluble, and how they get to there is by a way we will call that as passive diffusion. So that's how they're able to move aside the liver into these areas, whilst the water soluble, they are more have minimal metabolism in the liver, and if they have to get to other places, they will need what we call protein carrier or protein transporter. I wouldn't want you to worry with that. So let's focus on the fat soluble ones. So with this fat soluble, they are metabolized primarily in the liver, and the fact that they are metabolized by what we call the cytochrome P450, which is an enzyme system. I'm going to continue this in the next video. Thank you, Shade lovers.